Welcome back to theZoomer. Before we wrap, let's get to some of the questions sent in by you. The first from Sinai, and it reads this: what about testosterone for a treatment for low desire? Dr. Zlotta?
It's not my specialty, but I can definitely tell you that part of the women's desire is actually driven by testosterone. Everyone thinks about estrogens, but actually it's testosterone that drives in part. And maybe some of my colleagues can bring more information about treatment to overcome that.
Dr. Jacobson.
Thanks for asking. So yes, testosterone is absolutely associated with improvements in libido in postmenopausal women. And in 2019, we had a beautiful position statement written by the International Menopause Society that teaches us how to prescribe testosterone through the skin to women who are suffering from low libido. What's important to note is that there is no testosterone product that's approved for use in women in Canada or in the United States. There are some different products available that address libido in women. And in Canada, we have medications like a certain type of antidepressant that is approved for the use of treatment of libido, and certain types of hormonal therapy that include a testosterone-like product in them. But if we prescribe testosterone to women, it's an off-label use and a small percentage of what we would use in a man that we give to women, but the same product. And this needs to be done in a carefully monitored way. The other thing that I think is important to note is that testosterone plays a major role in female sexual dysfunction. But again, this is a totally multifactorial problem where giving testosterone doesn't only fix libido. There is other work to be done to improve libido in most women as well.
All right. And before we go, let's get to some quick final thoughts from each of you. Dr. Zlotta, I'll begin with you.
I think it's important, as mentioned, that whenever anyone sees blood, whether a man or a woman, definitely people should consult. If women see blood and have an infection, it might be something different than an infection. And if it's recurrent, again, bladder cancer is affecting them as well, and they should consult. That's a key message.
Dr. Gorfinkel.
Ask yourself your emotions when you see a doctor. You know, own those emotions so that you can understand the barriers between that and getting diagnosed. Because if you respect and you're too respectful, it could be missed. What's going through the doctor's mind? Oh my gosh, I've got patient A, B, C, D. What's going through your mind? I better be nice, otherwise I may not be liked. That's not the point. The point is to understand the problem so that we can work together to solve that.
Jane.
I think it's important before you go to the doctor to make a physical list, to write down a list of questions that you want to talk to your doctor about, because very likely when you're in there, you'll forget something that you wanted to discuss with your doctor. So when you're calm and you can think through what you want answers on, and then take that in with you, you can sit there with a pen and check them off, and then you can leave and feel good about the appointment.
And Dr. Jacobson.
I would say it's really important to advocate for yourself. So if you think that something is going on that is bothering you, whether it's a medical concern about a concern around cancer or a quality of life piece around hot flashes or libido or mood, it's so important that you bring it up rather than waiting for somebody to ask you about it. And if you don't get the answer that you're looking for and it doesn't feel like it was addressed, do a bit of your own research and ask again.
All right, and we'll have to leave it there. Remember, your voice matters, so make it heard. To get in touch, send us an email at comments@thezoomer.com. As always, thank you to my panel and to you at home. We'll see you soon. For now, it's time to zoom out.